We continue our look at the healthcare crisis on the Big Island, which is the fastest growing county in our state. The focus of tonight's report is on the leeward side of the island in Kailua Kona. In this Pride of Hawaii report, KHNL News 8's Leland Kim shows us how the doctor shortage there has already reached a dangerous level.
Kona Hospital stands as the medical backbone of the community. This is Dr. Stephen Denzer's home now. He closed down his private practice last year.
We were working harder and harder for less and less in an environment where there were no subspecialists and increasingly large demands on our skills and time, and it simply was not possible to stay in business.
He's not alone. In the last 5 years, 20 doctors left Kona. Only 5 have come to replace them. Doctors say lower reimbursements are partially to blame, but the Hawaii Medical Service Association, or HMSA, disagrees.
Our fees here in Hawaii are in the median, in the middle. There are metropolitan areas that have higher fees.
The shortage is compounded by growth on the Kona coast.
So it really is a primary care crisis. The population has probably doubled during that time. The hospital is full, perhaps saturated to the breaking point.
20 years ago, there were 13 primary care physicians serving the Kona community. Now, there are only 4. So patients without doctors come here for even the most basic medical needs. The ER has become the default doctor's office.
The emergency department on an average day is seeing anywhere between 20 to 40 people that do not have primary care physicians here in this community. And they are unable to get physicians here in this community that are willing to accept them.
So the ER has been forced to become a safety net for patients without doctors. It becomes a bigger issue if someone needs a specialist, like an orthopedic surgeon.
The insurance system has failed. There's no question about that. Medicare has failed, and HMSA has failed.
Patients hope something happens soon before this crisis gets even worse.
I'm afraid. I pray every day that nothing real big catastrophe will happen, that, that everybody will have to leave, or I don't know. But it's a very sad situation.
In Kona, Leland Kim, KHNL News 8.
HMSA says reimbursement rates are going up for next year, but doctors say the minimal increase isn't enough to attract new physicians to Kona and other underserved places in Hawaii. HMSA has pledged $50 million to fund improvements in participating hospitals.